The number of COVID-19 cases has surpassed 250 million people around the world. Meanwhile, here in the U.S., President Biden's vaccine rule for businesses is facing legal challenges. A federal appeals court has temporarily blocked the regulation, citing, quote, grave statutory and constitutional issues. According to the rule, companies with 100 or more workers must require employees to be fully vaccinated against COVID-19 or get tested weekly. With more on this, Justin Gill joins us now. He's an urgent care nurse practitioner and vice president of the Washington State Nurses Association. Justin, good to see you. So dozens of states have sued the Biden administration over this federal vaccine mandate. Some are even going after OSHA. Officials are calling it a constitutional overreach, questioning if the government has the right to require testing and vaccines. What do you know about OSHA's ability to address and respond to emergencies and pandemics?
Well, it's great to join you both this morning. I would have to say that, there's the legal arguments, which I think will certainly work themselves out in our legal system. But when we look at the merits of the arguments here, it really comes down to whether this is something that would be considered a grave danger to employees. OSHA has long been the agency, the regulatory authority that has maintained oversight over workplace safety and workplace safety issues. And COVID-19, I think, is something that we do consider a grave danger to all employees, regardless of whether they are immunocompromised or high risk. I think we've seen over the past year and a half that this is something that is very consequential to people's health and can certainly be considered a grave danger. Employees need to be able to work in an environment that is safe. And part of that means that employers should require that there should be a minimum standard of safety, which includes vaccination. I think that this also highlights the fact that there needs to be a uniform approach in tackling the issue across state lines. I think we've learned, especially from this pandemic, that state lines are not hard lines when it comes to COVID-19. And that people do travel across those state lines either for work or for other activities. And we need to make sure that there's a uniform approach to being able to address this issue across those state lines so that there's more effectiveness in that action. So this is something I think certainly will work its way through the legal system. But looking at it from a healthcare provider standpoint, it seems like a common sense approach to trying to tackle the vaccination issue.
On to the booster issue. More than 24 million Americans have received a booster shot, and some of those shots are likely to be mix and match doses. You actually worked on the National Institutes of Health mix and match trial. Give us some insight into what you learned firsthand about mixing doses.
Yeah, so I fortunately had the opportunity to serve actually as a participant in the trial for the NIH here locally in Seattle. And this was a great opportunity to contribute to the science. I initially received the Pfizer vaccine as my initial series when it first came out, and it's almost coming up on a year now. And I received Johnson & Johnson as the booster this time in summer for this year. And I think it helped me really reinforce the fact that there is a level of rigor and thoroughness to the scientific process that goes into these trials. It was very thorough, informed consent process, data collection process. It was a very consistent process to be able to collect the data to inform decision makers at the federal level to be able to advise mixing and matching doses. I think that this really highlights the fact that there is a full process when it comes to approving these vaccines and making these recommendations. And hopefully that'll instill some level of confidence. Healthcare workers have been working through this crisis over the past year to 2 years. And, it's something where it was helpful for me because it provided me with some additional protection during the Delta variant surge, but also helped contribute to the science. And I think as long as we remain committed to focusing on that piece, that there's a scientific approach to approving these vaccines, we can hopefully find our way out of this pandemic soon.
The U.S. has lifted a travel ban on 33 countries, as you know, reopening its borders to travelers that are fully vaccinated and test negative for COVID-19. Now, most of the countries in Europe are seeing a surge in cases. So should there be a concern about that?
Yeah, so I think that this is a great step as far as opening up our borders, getting back to some level of normalcy. And I think it's also very important that, the United States is requiring vaccination along with a recent negative COVID test. I think some of the issues that we're seeing in Europe are really related to poor uptake of vaccines in certain countries. And I think as we've seen from some of our own states, in some states or localities where there's a low uptake of vaccine and we see an outbreak, the impacts of those outbreaks can make a major be much more consequential for the surrounding areas. But I think if there is that consistency of requiring vaccination and also requiring that negative COVID test, I think that there's some blanket of or layer of safety when it comes to this policy change. I myself, am fairly confident in the science behind these vaccines. They do overall lower your risk of getting and transmitting COVID-19. Now, there's always the chance of breakthrough infections, but the likelihood of those are less than those that are unvaccinated. So, I think that this is a good step. It's a positive step, and I think we need to have that flexibility to reassess if things change. But hopefully, kind of continues on this path back to normalcy with vaccination as a requirement.
So now younger kids of 5 and older can get vaccinated. But, when we were talking about this change coming, I kept on thinking, geez, they really have to spend a lot more time and energy on marketing and informing than they did with adults, because even, parents who were comfortable getting the vaccine themselves, some of them may be uncomfortable having their kids vaccinated. So today, the Biden administration is going to be launching its nationwide campaign to promote child vaccinations. The White House is working to help schools partner with pharmacies in order to offer vaccine clinics. I remember when I was a kid, I just sort of got some of these vaccines in school, but I guess that's something that they're not really considering. What do you make of the effort so far by the administration to convince parents and to make it easy for parents to get their kids vaccinated?
Well, I think it's a necessary step here. In general, when it comes to vaccines in the pediatric population, there is a increased sense of concern or an increased layer of complexity when it comes to making sure that there is safety behind the vaccine. And from what we know, there's been and we've been waiting for this, through the fall, through the summer to get this approval. And it's been a very thorough process. But being able to inform parents and educate them so that they can feel more confident and comfortable in vaccinating their children is going to be extremely important here. I think we've learned from the rollout initially with the vaccines, there's the science behind the vaccines, but there's also the confidence that the public has in those. And in this case, the Biden administration is doing the right thing by wanting to promote the safety and efficacy of the vaccines for parents and their children. And I think that, when it comes to the part of schools reopening, we're starting to see a good number of regular respiratory viruses that we see ordinarily in these months. And this is, I think, going to be that final stage of this pandemic where we finally are able to vaccinate children, be much more comprehensive in our vaccination approach, and be able to overall drive down cases amongst children in schools and daycares.
All right, Justin Gill, thank you very much.
Thank you.